Good afternoon, everyone. Thank you so much for joining us. We're excited to be here today and talk to you a little bit about pregnancy during COVID. I'm Joanne Chihuahua. I'm a nurse midwife at the Center for Women's Health. And for those of you who don't know, midwives are advanced practice nurses. We accompany women through their pregnancy. So I see women in the clinic during their prenatal visits. I also deliver babies at St. David's, so I get to see some of my patients over there, and then I see them again when they come back for their postpartum visits. So pregnancy is always a time of incredible change and usually of great anticipation and excitement. But this past year has been a different year for all of us. And I've been seeing a lot of women who've been coming with a lot of emotional concerns and concerns about the what ifs of COVID. So that's why we've chosen this topic today. And I'm here with my colleague, Marianela Guzman.
Hi, like Joanne mentioned, I'm another one of the staff at People's Community Clinic. I'm one of the therapists that works at the Center for Women's Health. And my job there consists of whenever a patient comes in for their appointment, whether it's an annual appointment or a prenatal visit, if their provider feels like maybe they're experiencing some type of depression, anxiety, or they have a history of trauma and would benefit from talking to a therapist, they'll discuss that with the patient. And if the patient agrees, then they'll refer them to us. We'll call them to schedule an intake appointment where we'll get a little bit more information about what are some of the symptoms that they're having, the situation, and a little bit of background history. And at the end of that session, we'll discuss what the best option is for them, whether it's staying on with us for therapy or, if necessary, referring them to outside resources that might be a better fit based on their situation. So today we're going to be talking about COVID and pregnancy, and these are just some of the topics that we're going to be covering. We'll talk about COVID-related stressors. We'll go more in depth about anxiety and depression and what those might look like, as well as ways in which we can cope with the unknown right now. We'll also talk about ways that you can stay healthy during your pregnancy.
We'll talk a little bit about what happens if a pregnant woman gets COVID and what does COVID mean for pregnant women in general. And then about the vaccine. Is it possible for pregnant women? Is that desirable? And finally, we want to leave you with some coping strategies.
So like we discussed, pregnancy is a really beautiful time that also comes with its challenges. But especially this past year, we have to add to that the additional layer of all the challenges that COVID presents. It's not just the illness itself, whether we might get it or pass it on to a loved one, especially during our pregnancy, or have family members experience it. There have been many of us who have lost loved ones to COVID. There's also the financial stressors that come with it. A lot of people have lost their jobs or had hours cut. There's also the stress of, whether you might get COVID at work. And then for those people that live on their own, it can feel extra lonely. For those that live with people, it can feel extra crowded. So there's definitely those challenges. But the important takeaway is you're not the only one going through this. I know sometimes it may feel like, we don't have control over the situation, or we're the only ones that are feeling, depressed and overwhelmed and anxious. But the reality is this is something that everyone is experiencing right now. But just because it's something typical of the time doesn't mean that it needs to stay this way. So I want to go in depth with you guys a little bit more about not just our typical stress, but more about what anxiety and depression may look like. So it's typical for us to experience stress in our day-to-day lives, whether it's related to traffic or work or, issues at home. Sometimes stress can be really useful. It helps us be more alert and can make us realize sometimes whenever we are feeling stressed out, it could be a sign that we're picking up on something that is making us feel unsafe. And it's a way that we can protect ourselves in that sense. The issue becomes when this typical stress starts to affect the way that we live our day-to-day lives. And so compared to like anxiety, for example, some of the ways that anxiety might present itself is it tends to present itself in a more physical way, whether, it's feeling like a lot of just anxiety in your body and feeling really like antsy. You can also notice changes in your breathing. Sometimes you realize that you're breathing a lot faster, that your heart is like beating really, really fast, or that your thoughts are moving really, really, really quickly and you will have a hard time controlling them. Depression can feel more like, experiencing changes in appetite, feeling like you're eating more than you used to, or loss of appetite, changes in sleep patterns, feeling like you're having a hard time going to sleep or staying asleep, or the opposite, feeling like you're sleeping too much. We can also experience more irritability, feeling like things overwhelm us more than they used to. Sometimes feeling like we want to cry and we don't really know, what triggered this, feeling lonely, feeling down. We may notice that we're not as motivated as we used to, or we're not enjoying the things that we used to enjoy like we did before. As you can tell, these symptoms are things that you can experience in your day-to-day, right? The problem is when you start experiencing all of these in a cluster, that's when you need to pay a little bit more attention, because it could mean that you're starting to feel depressed or anxious. And, it's okay. Whenever we start feeling like this, it's important to ask for help and reach out. Sometimes it helps to have somebody to talk to. Whether it's a family member or a friend that we trust. But sometimes it's important to reach out to someone like a therapist. At times we feel like we don't want to overwhelm our family and our friends, with the things that we are carrying, or we don't want them to worry about us. So meeting with a therapist provides us that safe space where we can really talk about what are some of the things that are bothering, in a place where, we won't feel judged. And on the contrary, the therapist is going to be there to offer you techniques and skills to help you address these different symptoms and help you move past it. It's really important during this time to be really flexible with ourselves. We may not control everything right now that is happening during COVID, but we can sit down and say, okay, so maybe I can't control these things, but what are the things that I can control? We can continue to choose to wear masks out in public. We can watch how much, distance we keep from other people. If we go to the grocery store and we realize that it's really packed, we can choose to leave and come back another time. So within this really uncertain time, there are still things that we can control. It is also really important for us to be very compassionate with ourselves, to adjust our expectations and our perspective of the situation. So if right now, maybe we're unable to operate at 100%, maybe our emotional capacity right now only allows us to operate at 80%, that is okay. That is good enough. So again, adjusting those expectations and our perspective on the situation can be really helpful. If maybe before we were used to having, the kids at home and family and being able to cook like a 3-course meal for them, maybe right now all we can muster is, making a sandwich for the children. That is good enough. So again, making sure to be flexible, be compassionate, adjust our expectations, and definitely ask for help when needed.
So this year has definitely been challenging for many people, and I think most of us have touched those moments of anxiety and maybe a little depression. But I want to emphasize that caring for yourself and your baby during pregnancy is essentially the same thing. So we need to change, modify some of our behaviors, and we need to maintain social distance. We must wear masks and wash your hands frequently, but we don't want COVID to become our life at this point. We want to still appreciate, enjoy, and care for ourselves and our growing baby. So it is important still to come to your regular prenatal visits. I've had patients tell me that they were really fearful of contracting COVID in the clinic, and so they delayed care until late in the 2nd or 3rd trimester of their pregnancy. And it's really important for you to come from the beginning. So we'd like to see you in the 1st trimester, and we've made a lot of changes too in the clinic, and I'll go over that, and also in the hospital, to make sure that we are not a place where you're at risk. It's really important for you to eat healthy foods. So some of us, when we are feeling stressed out, we tend to go to those comfort foods. But in pregnancy, you need to have less sugar, less processed foods or fast foods, and more fresh vegetables. I know for some of my patients, it's been a challenge to have enough food at home because of changes in employment and finances. Well, in pregnancy, there are additional resources, and we can definitely help connect you with those. So come early and ask for what you need. It's still really important to exercise. I've had patients tell me that they don't go outside, they don't let their children go outside because they're so afraid that they could get COVID. Being outside is a very low risk place to be, especially if you're away at a distance from other people. So taking a walk, taking your kids outside to catch a ball, run around in a park, walk your dog if you have a dog, all of those are great activities for pregnancy. Still, there's times when we need to be able to exercise at home. Some of us with small children, we can't just go for a walk. So having videos online that you can do during your pregnancy is a great alternative. YouTube has infinite amount of exercise videos, and you can start simply by Googling prenatal exercise, or you can look prenatal yoga or prenatal Zumba or whatever it is that you might like. So just make sure that you're trying to do something 20 to 30 minutes on most days during your pregnancy. You'll have a healthier pregnancy, usually an easier delivery, and definitely easier recovery postpartum. And I like to also emphasize, Marianella went through, a lot of the stress and ways we can cope and the ways we feel in our body. It's also really important to take time to get out of our heads and to really feel our bodies. This is our only pregnancy with this particular baby that you're carrying right now. So enjoy those moments, feel the movement of your baby, get to know their weight and their schedule and what they like to do and their hiccups. You want to be forming those memories. You want to talk to your baby. They can start hearing your voice at 22 weeks. So start talking to your baby. All of that is really important for your mental health and for bonding with your baby. So as I mentioned at the clinic, we've made a lot of changes. When you come to the clinic, we're not going to have you waiting in a crowded waiting room. Most people will wait outside, either in their cars or outside in a nice day until it's their time to come in. And then the staff will be wearing gloves and masks. You'll have more telemed clinics. So we do want you to come in. There's times we need to see you. We need to do lab work. We need to listen to your baby's heart tones. But times in between those crucial visits where we can connect over the phone and see how things are going. Of course, I want to emphasize that if you feel you need to be seen in clinic, you absolutely can change those appointments and make sure that you have them in the clinic. And we're also always available to answer questions. So if you have concerns in between your visits, you can call and ask to speak with a nurse. At St. David's, there's also been some changes. People have been afraid that they would be laboring alone. I've had that question a lot. Am I allowed to bring anyone? And yes, I feel like that is a basic right, that a laboring woman must have a support person with her during labor of her choice. So you may bring one person older than 18 to be with you during your labor. And also, if you want to hire a doula, you may bring a doula in addition. For those of you who don't know, a doula is a professional who has training in how to support a woman during her labor. So the staff at St. David's is also going to be dressed with their gloves and their mask, and every woman who comes in and is admitted in labor is going to be tested for COVID. If you're positive, the staff are going to add more layers to their PPE, but they will still give you excellent care. You'll still be able to have someone by your side, and you'll still be able to have your baby with you. All right, lots of questions about what does it mean to have COVID in pregnancy. So first of all, pregnant people are at risk a little higher than pregnant people who are not pregnant. People who are not pregnant. Pregnant people who are COVID positive would likely have more severe disease than non-pregnant peers. Still, the vast majority of pregnant women who are COVID positive are asymptomatic or have very mild disease, but just saying that they're more likely to have a severe form of COVID than their non-pregnant peers. Pregnant people who are COVID positive may be at higher risk for poor pregnancy outcomes like preterm birth. So we're still gathering a lot of data, a lot of information, but the CDC has found that pregnant women are among high-risk groups. So that's important to know. It's still very important to care for yourself during pregnancy. And then for Black and Hispanic individuals who are pregnant have disproportionately higher rates of COVID infection and death than white individuals who are pregnant. And this, of course, has to do with systemic racism and so much about access to care and the quality of care received. I want to also say that, most of the women that I've interacted with who are positive in pregnancy only find out because they get that test when they go into the hospital. So they've had no symptoms and all of a sudden they get a positive result. And they're very concerned about what's going to happen to my baby. So in terms of newborns, it's very rare that a woman passes the COVID on to her baby. Occasionally they do find that babies are positive, but a very small percentage of those babies have any form of disease, and the vast majority who do show symptoms have very mild symptoms. Your baby still needs your breast milk. Breast milk is an incredible benefit, so many good things in there for your baby, for the developing immune system, for intelligence, benefits that last the baby's life. So even if you're positive, we still really encourage you to breastfeed. We would recommend that within that window that you're infectious, potentially infectious, that you would wear a mask and be very good about washing your hands. But we still want you to spend that time with your baby, skin to skin, and breastfeeding as often as your baby wants. The COVID vaccine is being offered to pregnant women because pregnant women are a high-risk category. And there's been a lot of questions. Pregnant women were not included in the trials. And so how do we know really that this vaccine is safe? Well, for one thing, we now have many pregnant women who have been vaccinated, or women who have been vaccinated and then found out they were pregnant. And from the data that they've been gathering with that, we've seen that there's not an increased risk to the pregnant woman or her newborn. The vaccines that we have are not live vaccines, so they cannot cause disease. They do not enter the cell's nucleus. They don't cause genetic changes, so they wouldn't result in any malformation or problem with the development of your baby. A lot of people get confused about side effects and disease itself, and it is confusing. Sometimes people have symptoms that look like mild forms of the disease. They can have flu-like symptoms with or without a fever, but most often these symptoms resolve in about 3 days. And I really want to emphasize that these symptoms are not the disease itself. These are side effects that are expected. This is a sign that your immune system is being stimulated appropriately to respond to the potential disease, so to create those antibodies. And that immune response happens when we're sick, and so that's why we feel like that in a natural course of illness. But because we know that the vaccine cannot cause disease, this is just the stimulation of the immune system. So after talking about all of that, some heavier topics, anxiety, depression, and COVID and pregnancy, we wanted to leave you with some coping strategies. This is your pregnancy to enjoy now. We can't put it on pause while we finish the pandemic. We want you to be in the moment and have ways that you can enjoy this moment, even when there is stress all around us. So one little piece of advice is to create a list of activities or actions to boost your mood. This is something that you should do when you're feeling pretty good, not when you're feeling stressed or depressed or anxious, but it's something that you can go to in those times. So you want to create as long a list and varied a list as you can think of, and just brainstorm all kinds of things. So take a walk, call a friend, listen to a particular piece of music, hug one of your family members, listen to a particular podcast, or take a shower, smell something that smells great that you really like, go outside and take a deep breath of fresh air. So all of those can be on your list. And then when you're feeling like, I don't feel like I can do anything, I don't want to interact with anybody, maybe I just want to stay in my bed, then you can go to your list and say, okay, let me try one of these things. Let me see if I try this, if I'll feel a little bit better. So have that ready for yourself. Definitely go outside. We're meant to spend time outside. We need the sunshine. We need vitamin D. So don't lock yourselves away. Spend a little bit of time outside every day if you can. Whether you have a place right by your house or just on your patio, just outside behind your house, or if there's a place a few blocks away that's safer or you feel more comfortable, find a place where you can spend time outside, and even with your kids if you have kids on a regular basis. It's still important to socialize. We need to do that safely. We have to keep our social distance and wear masks, but we don't want to isolate ourselves. So Zoom is something that we're getting used to, but it doesn't mean we have to love it, and doesn't mean that all our social interactions have to be by Zoom. So if you want to have a family member you don't live with come over and sit outside at a distance and have a chat and share some laughs, that's a great boost for your mood. Find time for yourself. So many of us live in homes with a lot of people in a small space. And during this time, I mean, with the winter storm that just happened was another period where we're all locked up together. So sometimes we've had too much time with the people that we love. But it's important to find time for yourself. So whether, again, that's stepping outside for a second, going on a walk, or just closing the door when you're in the bathroom and taking a shower with a good smelling soap, whatever that is for you, finding a way to just be present in your body and have a few minutes to take some deep breaths.
So I wanted to make sure that we have enough time at the end for questions. So I think we can go ahead and do the 5 senses exercise.
Okay.
So this is actually a really great exercise that I love doing with my patients. It's really easy to remember, and you can basically do it anywhere. You know, if you're at the grocery store and you're starting to feel a little bit overwhelmed and anxious, or you feel like, you know, your thoughts are sort of getting ahead of you, this is a really wonderful way to sort of hit the brakes and ground yourself, which can be really, really important whenever we're feeling anxious. So I, first of all, like by starting by paying attention to our body. One of the first things that you'll notice whenever we're feeling anxious is our breathing gets really, really erratic. So I like to take a pause and just take 2 deep breaths. So we're going to go ahead and do that right now. So we're going to take a deep breath in. And again, deep breath in. And let it out. And I don't know about you guys, but I'm already feeling a little bit more calm. So then after we take those deep breaths, we're going to go ahead and start with the exercise. So it involves the 5 senses. So first, I want you to find 5 things that you can see and really, you know, pay attention to them. So right here in front of me, I can see Joanne on the screen. I can see the computer mouse right next to me, my phone in front of me. So that's 3. I have some little post-it notes here. So that would be 4. And lastly, I have some pens in front of me. So that's 5 things that I could see. Now, 4 things that you can touch and really take the time to touch them and feel the texture. So the texture on my coat, you know, it's really soft and warm. I can feel the texture of the string on my headphones. It's like knitted. I can feel how smooth the screen on my phone feels. And my cup, it feels a little bit rough. So just really take the time to just notice that texture, because again, we want to bring our mind to the present. So that's 4 things that you can touch. Now, what are 3 things that you can hear? So here, sitting in, you know, this room, I can hear my breathing. If I really pay attention, I can hear the air conditioning in the background. And I can hear somebody in the background moving some things around. So that's 3 things that I can hear. Now, what are 2 things that you can smell? And this is definitely one of my favorite parts of the exercises, because like for me right here, I have a scented candle, which smells like lavender. I love the smell of lavender. So really just take the time to just smell whatever you have on hand. And it doesn't necessarily have to be a candle. You can even just, you know, if you took a shower, you can smell the shampoo in your hair, or, you know, the fabric softener of your clothes. So that's actually 3 things that I could smell. And last but not least, what is one thing that you can taste? And I was going to bring a chocolate, but I'm not going to eat that in front of you guys. So one thing that I can taste is my water. I can feel how cool that feels running down my throat, and it's really refreshing. So again, like I mentioned, this is a really great exercise because it's super easy to remember. You just take your 5 senses and you're going to go 5, 4, 3, 2, 1. You can modify it whichever way you can if needed. If you're eating, maybe instead of 5 things that I can see, what are 5 things that I can eat? And really, really take the time to savor them. So this is a really great exercise to ground us whenever we're feeling kind of anxious. Hope you guys enjoyed it.
All right. Well, thank you so much, everyone. And we have a few minutes for questions. So if anyone has any questions, let us know. Let's see. We can also post a few things here, links in the comments for exercises. And I have a couple great sites for breastfeeding resources. One is called Breast Milk Counts, and it's got just a ton of information, facts and myths about breastfeeding, how the people around you can support you and make sure that you have success in your breastfeeding. And another site that has videos of women breastfeeding and really goes through and shows you, okay, this baby is doing this well, is attached well, and shows you what to look for. Because I think a lot of people who are not used to breastfeeding don't really know what to look for. So that can be helpful. Okay, Mariana, it looks like the first question might be for you.
Okay, so what are some ways friends can help relieve stress? So I know a lot of times we don't want to bother people, but one thing that I really like to remind our patients is if someone offers help, take it, because nobody's going to offer you help that doesn't want to or can't. So if someone offers to stop by and help you clean the house, just say yes, please. If someone, offers to come and watch the baby while you take a nap, the answer is yes. So just make sure that, if your friends are offering the help, make sure to take it, build your tribe. It really does take a tribe to raise a child. So make sure that you do build that tribe and make sure that you tap into it when you need the help. And a lot of times it's also important to ask for that help. Sometimes if our friends, maybe feel like they don't want to bother us, but we feel like we need help, it's really important to make sure and ask for that help when we need it.
Second question here is, the pandemic has made it hard to meet new mommy friends. How do you suggest safely building a community around a newborn and mother during the pandemic? That is a great question. And I think that hits right at the issue we're talking about, social isolation. So it has been really hard. I mean, how do you meet people when you have to cover up half your face and you have to stand 6 feet away? I think there are still organizations that are serving women in groups in different formats. So Mama Sana is one. That's a really wonderful local organization. I recommend just Googling it, and they have yoga classes and participating in things like that. And it might mean that initially you are talking over Zoom, but eventually, hopefully you can encourage women to gather still in an outside space where you can all kind of have your chairs at a distance and maybe, breastfeed together or chat, or, making sure that, reaching out on Facebook, social media to other friends of yours who are pregnant, and just, building those friendships even at a distance is still very important. Okay, what extra precautions should we take when going to the hospital in regards to COVID? So really, they are directing you to be safe at the hospital. You're not allowed to walk up and down the halls. You're only having that one person. They're going to take your temperature. They give you a mask at the entrance if you don't have one. So they are cleaning the rooms extra well to make sure that there's no risk to you when you're admitted to the hospital. So I think really, my encouragement would be try not to focus on that so much, and just know that everybody is doing their job to really make sure that you have a safe experience at the hospital. Is prenatal yoga really beneficial? Is walking just as good as for pregnant people? I would say whatever moves your body, whatever gets you exercising is beneficial. Prenatal yoga is not for everybody, but it definitely helps build muscle strength and core strength. A lot of complaints pregnant women have to do with their backs and their hips. And I think prenatal yoga is great for helping prevent that and working out all the aches and pains, especially around the third trimester. So prenatal yoga is a favorite of mine, but that doesn't mean it's for everybody. So if you prefer taking a walk and that feels good to you, then definitely do that. Marianella, maybe you can take that next one.
Yeah, so any tips for staying motivated or simplifying cooking routines? I have phases of wanting to just eat out because I'm tired of cooking and eating / planning my own food. Yeah, that can definitely be a tough one. I know one thing I've suggested to some of my patients, which they have found helpful, is sometimes it helps to just, cook in bulk and freeze it. It can make things a little bit easier than just having to plan out what you're going to cook each day. So sometimes just dedicating one day, one afternoon, whether it's on the weekend, and trying to find ingredients that can work for multiple recipes and just trying to spend all afternoon cooking. You can put it in little baggies, freeze it, and then that way you don't have to worry so much about going out and eating out. And plus you save money too, because eating out can get pretty expensive.
I'd like to piggyback on that. I think that's a great advice. And even for preparing for your postpartum, it's really wonderful if you don't have those support people around you that you cook ahead of time. I've had a patient, I remember she had a family, I think she had 5 children, and she managed to cook enough food that she fed her whole family for her first 6 weeks postpartum just by pulling things out of the freezer. So, doing stews or soups, and you can freeze them in like a gallon bag and then just stack them in your freezer. So that's really good. Another shortcut is if you have a crock pot or can get a crock pot, that's a great way to just not think about it and not spend all afternoon, but just throw something in it in the morning with, your chicken or your beans and then some other seasonings, maybe some tomato sauce. And then by the end of the day, there's dinner. It's already done. So sometimes we all get, have a hard time staying inspired with food, but I think trying to make it easy and figuring out what works for you is helpful. Well, thank you so much. It looks like we've gone over a little bit, but we really appreciate your attention and your time, and we hope to see you in the clinic.
Thank you so much for joining us.